In regards to that last video on the potential harms to the fetus from using cannabis during pregnancy, I got a lot of comments about what if you were using it for morning sickness or for hyperemesis gravidarum. And it's a great point because this is going to be usually a less toxic nausea treatment than others, but there's also the possibility that what you're actually dealing with is cannabinoid hyperemesis syndrome. So I'll cover what's known now, but I am sad to say that there are, as far as I know, a total of 15 papers on the entire planet on this subject, which just goes to show how woefully short we are on researching anything to do with women. It's a crime and a shame. I'm Lex Pelger. I do can education for CV Sciences, the makers of Plus CBD. On the cannabinoids, ask me anything, and I would love to hear your stories about this, and I'm sure other people would be helped by that too. For healthcare professionals or for pregnant people out there, this is probably the most helpful paper that exists. It's a case report as well as a literature review of the little bit that's been done around this. The hardest part about what's going on here is that the difference between hyperemesis gravidarum, which is a side effect, a very serious side effect of pregnancy, and cannabinoid hyperemesis syndrome, which is a severe nausea side effect from using cannabis, is there's pretty much no way to differentiate it. In both conditions, there is extreme nausea, sometimes to the point of weight loss. There is dehydration to the point of electrolyte balances being thrown off. There can be serious negative side effects from these, and you can't really tell whether it's the cannabis doing it or the normal pregnancy. Unfortunately, cannabis could be providing some relief while also still being the cause of what's going on. You hear about that fairly consistently in cannabinoid hyperemesis syndrome is the weed helps 20% with the nausea, but it is because of the dysregulation going on inside you that you have the nausea in the first place. And it can take up to a month or two after you stop using cannabis for these symptoms to disappear. And in many pregnancies, by that point, your nausea has already disappeared anyway. So it can be hard to tell what is the reason. That being said, I do want to agree with most of the comments where people saying, well, overall, it's just not that bad, especially if you need it to treat nausea. And yeah, that's true. I think smoking cannabis during pregnancy isn't that big a deal, despite those negatives I listed in the last video. But there's one case report here of someone smoking 20 bowls a day until she lost consciousness. And so there has to be a balance here. And for physicians, you have something very tricky because the typical antiemetics don't work. The other treatments like the antipsychotic haloperidol or the TCAs, the tricyclic antidepressants, I mean, those are pretty hard things to be giving. And so I don't have many answers, but this is a good place to start looking.